Good afternoon, everyone. I'm sorry that I can't be with you in person today to celebrate the great work that you do day in, day out to improve care and services for patients across Powys. I know that your Staff Excellence Awards are about recognising and valuing the impact you make in all areas of work, and I wanted to say this opportunity to say thank you for the difference that you make. When you work in such a busy and challenging environment that is the NHS in Wales, there's often not the time to stop, reflect, acknowledge and indeed celebrate the dedication and innovation of staff who are making such a valuable impact on the care that is being provided, and that's why today is so important. Powys Teaching Health Board has set itself an ambitious agenda. It's focused on delivering care closer to home that is truly centred on the needs of the individual. It's working continually to improve the health and well-being of the people of Powys and to provide effective health services at the right time in the right place that can be accessed by all. And we also believe that Powys can act as a lead for all of us in Wales in areas like primary care, working with other public services, in its commissioning role, and in delivering community and rural healthcare in its services. It's also in the unique position of building particularly strong relationships with Powys County Council and the voluntary sector to deliver improved integrated services that have quality running through them. And as a deliverer of rural healthcare, you face many challenges in providing services that can be easily accessed by those who need them and are finding new ways of working differently. Alongside this is the Health Board's commitment to deliver prudent healthcare to drive forward improvements in patient care and change the way services are delivered to ensure the NHS not only survives but thrives. In essence, prudent healthcare is about using the limited resources of NHS Wales wisely and doing everything appropriate rather than anything that is possible. At its heart is a partnership between healthcare staff and patients, with partners playing an integral part in designing services and patients in terms of the role that they want to play, which meets their needs as well as takes more responsibility for their own health and well-being. This engagement and co-production approach is already being taken across Powys Teaching Health Board and will be an integral part of so much of your future work, including your strategic delivery programme and your agenda for integration. Staff and partners within Powys Teaching Health Board are clearly rising to these challenges with a plethora of developments I think you should all be very proud of. So take for example the virtual ward, which I was delighted to see win the overall Innovation in Care Award at the recent NHS Wales Awards. This development, which was introduced by staff, demonstrates the strength of integrated working and has resulted in huge benefits to people who have used the service. It's helped them to avoid admission to hospital and to receive more seamless care closer to their home environment. The running of the Glanirvon Health and Social Care Centre is another demonstration of close working between health and social services alongside local people. And I know that the feedback from those using the service is positive. And again, this is down to the hard work of all staff in making sure that this is a success. Another clear example of prudent healthcare in action that has reaped benefits is the development of the specialist leg clubs across Powys, which enable patients with leg ulcers to receive treatment collectively in local community venues. Organised by district nurses in partnership with local communities, they are enabling patients to have more say in their treatment. And it's fantastic to see that more than 2,300 patients are using leg clubs and benefiting from improved care and well-being, as well as the hundreds of thousands of pounds saved in district nursing costs. There are so many examples of good practice in Powys, including GP-managed practices that are making a real impact, and the work that's been done to improve care for patients with carpal tunnel by effectively using resources to deliver a better experience. What's significant about all of these examples and the great work that you'll be celebrating this afternoon is the huge role that staff play in both the overall performance of the Health Board and the experience of patients and service users. As your recently introduced Chapter Change programme reflects, the values and behaviours of an organisation are integral, recognising that our health services are run by people, for people. The values and behaviours shape success as judged by those we work with, including patients, staff and our other colleagues. And with this in mind, it's great to see that each award finalist and winner this afternoon has been nominated by staff and decided by staff. It's heartening to see that so many people have been nominated across all areas of Powys and all departments, showing the widespread good work that is taking place every day. The Staff Excellence Awards not only celebrate the success of staff in delivering work that has improved care and services, but provide a real opportunity to learn from colleagues and share that improvement knowledge with others. It doesn't have to cost a lot of money to make a real difference, and as NHS Wales begins to really focus on prudent healthcare, It's great to see that there is already a sound platform to build on. I look forward to seeing what further contributions will be made by all of you in Powys in the coming year, and would just like to wish good luck to everyone nominated this afternoon. I look forward to finding out who wins. Thank you and good luck. Diolch yn fawr iawn ac pob lwc.